Hello, everyone. Welcome back to the BioNexus Health podcast, Autism Autoimmune. Today, we are going to do something a little bit different. We are having a mother's support group for many moms from Europe, and it's going to be a Q&A format. So let's go ahead and welcome many different moms from different countries in Europe.
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hi, Alexandra. It's good to see you again.
Hi, Dr. Dashore. Nice to see you again.
So you have invited a few moms from Europe to join in the Q&A session today. So let's see. We have Maria, Juliana, there is Nicoletta, Elena, and Alina.
Yes.
So can you all please introduce yourselves one by one? Actually, Maria, everyone, can you turn your videos on so we can proceed? Yes.
Hello.
Hi, Maria.
Nice to meet you.
Nice to meet you as well. You're from where
I'm
are
from
you?
UK, from London. I'm a good friend with Alexandra as well.
Ah, okay. Welcome to today's it's a Q&A. It's more like mother support group, also fathers, of course, if any fathers decide to join us.
Yes, and also I have invited people that have got like adult problems, which is a big thing happening now. And even myself, I'm confronting myself with some symptoms that we don't really know what's happening over UK and Europe. We seem to have some symptoms and we can't explain them. And that's why I was thinking is a good opportunity not to talk just about the kids, but talk talk of the adult symptoms as well, because they seem to be related with all this autoimmune input that is happening lately.
Yes, absolutely. In our age group, from anywhere from 35 to 55, there is a lot of autoimmunity happening around the world, is what I've seen. It's a lot of multiple sclerosis, a lot of Alzheimer's, neurodegenerative conditions. And some of the reasons we can discuss them, and some of them we cannot. Otherwise, the podcast will be banned.
Yes.
So now let's see. Who is next? We have, I think Nicoletta. Nicoletta, hi, how are you?
I don't know.
Are you are you connected to audio, Nicoletta?
Yes, she is.
I don't know.
I guess.
Maybe she's not. Okay.
Nicoletta has got almost a teenager diagnosed with autism and epilepsy. And he's at the moment.
Okay. And Juliana, you are, hi, there, where are you? Yeah.
Yes.
Good to see you.
From Romania.
Yes. Oh, right. You're from Romania. And
this is Stefan.
Hi, Stefan. So good to see you. Look at those beautiful eyes. Okay, then let's see. Then we have Alina Popovici.
Hello.
Yes.
Hi, Alina. How are you? Oh, hi. Oh, we have another cutie pie.
My son is with autism, and no, mom.
Where are you from?
From Romania.
Okay. Wonderful. Good to see you.
He's diagnosed with Gilbert syndrome, if I'm not wrong, Alina, isn't it?
Okay.
Yes.
I've had many patients in the past. I would say 7 patients with Gilbert syndrome before.
Mommy?
So let's see. Mariana is here. Hi, Mariana.
Hello.
Gata.
And you're from the UK, right?
Yes.
Yes, of course. I mean, I know you, of course. Good, good, good. I'm glad you made it. Elena, do you want to say hello? Do you want to introduce yourself, Elena? And Alina is going to probably join us from another device. No,
Hello.
Alina is here.
Hi.
I'm sorry, not Alina. Elena is here in a beautiful green top. Hi, Elena.
Hi.
And where
Hello.
are you from?
I'm Fășani, Romania.
Okay, good. I'm glad to see you here today. So last one to introduce would be Nicoletta. Nicoletta, can you hear me now?
Not able to see us or to hear us. She just texted me.
Right, yeah, something is up with the audio, I think, for Nicoletta. Right, no problem. All right, so let's get started. So now we know who all are here, and if anyone else comes in, you know, we will, I will let them in. So how is, you know, if anyone wants to ask a question in your language, right? Alexandra is able to translate, and I'm, you know, happy to answer.
Dacă nu vă descurcați cu tradusul, îmi spuneți în română și eu o să traduc, da?
Right, so who wants to begin? All right, we only have an hour, so somebody start. Alexandra, you want to start, or Alina wants to start? All
Alina
right.
wants to start. Alina has a question.
Yes, of course.
Eu o să vorbesc în română, că nu pot să mă atât în engleză foarte corect. Dacă
Ok.
mă poate ajuta.
Aduc eu.
Aș dori să știu dacă sindromul Gilbert influențează cumva autismul. David are niște simptome de mic și noi am făcut multă terapie de ajuns verbal și la nivelul care este, dar aș vrea să știu dacă influențează acest sindrom. Din ce am citit, ar avea influențe, dar aș vrea și părerea mea.
How much would his syndrome, the Gilbert syndrome, it's influencing his autistic symptoms? He is verbal now, but he is verbal after many years of therapy, intensive therapy. And
Okay.
she'd like to know, I think she wants to know more like, how much is it the Gilbert syndrome and how much is the autism side of the story? How much is interfering?
Okay. So Gilbert syndrome is something that affects the liver, right?
Yes.
So that is the main detoxification organ in the body. And we know that children on the spectrum can have various problems with their detoxification mechanisms. Like, you know, they can have genetic mutations, they can have methylation, they can have problems with methylation, sulfation. They can also have problems with glucuronidation issues as well. So having Gilbert syndrome can make the symptoms of autism a little more complicated. Okay.
Ai înțeles, Alina, ce a spus domnul doctor?
Da, și aș mai avea câteva de adăugat.
Okay.
Noi am depistat la vârsta de... Când a început să aibă simptome, a coincis și cu întoarcerea mea la serviciu și am depistat un pic mai târziu că aveam un cegai în spatele dulapului de pe hol. El a stat acasă mult timp cu bona, noi am fost la serviciu, el a fost mult mai expus ca noi, bine, creierul în funcțiune. Eu de Gilbert am aflat acum 2 ani, când am început eu să-i fac analize. Nu știam pe atunci, a stat și în mucegai, vreun an. Noi am depistat târziu mucegaiul din spate Și a mai fost și capsat, să zic, a mușcat, dar zgâriat mai mult, de 2 ori de căței. Și a dat sânge, adică a fost zgâriat, n-a fost mușcat și n-a fost nevoie de vaccin. Mi-a spus că vaccinul de la vârsta de 1 an cumva de antitanus cumva acoperă. Și de asta cumva la un loc toate.
Nu știu exact cât e Gilbert, cât e
Cât e
autism,
Gilbert,
care
cât
sunt
e, cât
este
e
mucegai.
de
So
căței,
basically,
cât e mucegai, toate cred că.
the child has been also exposed to a lot of mold before.
Oh,
Now she's very confused because she doesn't really know if it's the genetic syndrome or is the autism symptoms or is basically the mold, the biotoxin illness.
okay, okay. Yes, it's probably all three,
Yeah, or
right?
what
It's probably,
use so she can understand exactly what's going on with the child.
right. So it is probably all three problems causing complications, right? Because all three are definitely diagnosed in the same child. And the one way to proceed, it's always important to investigate with the labs. And then once the lab results come in, then, you have to prioritize what is the most important thing to treat first. Because, for example, if a child has autism, well, I'll take the Gilbert syndrome example itself. If you have Gilbert's, if you have autism, and if you have mold toxin exposure, then the first priority is what? Is to bring the inflammation down. Treating Gilbert's, treating autism will not get you a whole lot of benefits. You will not reach the full potential if you don't identify all the triggers for the inflammation in the brain and in the body and bring that down. Okay. So it is important to prioritize. And then, of course, children can get better. Right, Alina? Yeah, was that understood?
Yeah, she said thank you, but I think you
Good.
broke. That's why.
Da.
Okay, good, good. All right, who is, I see that Nicoletta was able to join us. Hi, Nicoletta, I hope you can hear me now. I think she is on mute, but let's see. There's someone else who came into the meeting. That's all right, no problem. All right, who is on next? Any other questions?
Oh.
Well, considering that some of us are already patients and somehow we already know what's going on.
Yes.
Let's leave the new person that haven't had the chance to speak to you
Yes.
first, then we can just go ahead and speak, because otherwise we can speak in the consultations.
Yes.
Elena, you want to go ahead and
Who wants to proceed? Nicoletta, Elena, who?
I want to ask something.
Yes, Nicoletta, go ahead. Nice to meet you.
I want to ask which is the different to the Lyme and autism, because many kids with the Lyme is diagnosed with autism, and I don't know if I can do the different to the symptoms.
Yes, no, that is a very good question. Now, Lyme disease can sometimes be physical, like, sometimes children have problem with arthritis, they have problem with walking. So there are different problems because of Lyme disease. So that gives you a clue that there might be some Lyme disease and co-infections happening that is making the symptoms of autism appear worse. Then on the other hand, in many people, all ages, even adults, Lyme disease and co-infections can only give you neuropsychiatric symptoms. That is where it gets very confusing. That, is it really Lyme? Is it autism? And like I always say, it's best to straight up run the labs, stay objective, and understand that Lyme disease, even if it is only Lyme disease, it can still cause brain inflammation, damage to the neurons, damage to the gut, damage to other organs in the body as well. So you have to treat both. If you have a child who is 10 years old, for example, and he was born with Lyme disease, meaning, you gave it to him in utero, which is what happened to me. I had no idea that I had passed Lyme disease and co-infection to my son. And he was diagnosed on the spectrum, Lyme, PANS, PANDAS. So at that point, if Lyme disease has been there for so long in utero, as well as, the child is already 3 years old, 2.5 years old, by the time they are diagnosed with autism, maybe 80% is Lyme and only 20% is autism. So that is something which you have to be very clear, very objective. You have to run labs. You have to do full evaluation. And then we treat. And, children get better. Children do really well. Right,
And
Nicoletta? That makes sense?
yes, I understand. Thank you very much.
Of
And another
course.
question, why some kids develop epilepsy, like my son, when it have 10 years old, and another kids doesn't do this one? Which one is the different?
Okay.
Yeah,
Okay. So
thank you.
that will, the epilepsy depends on each child. If there is high level of infection, that can be an epileptic trigger. If there is high level of inflammation, that can also be an epileptic trigger. So I have many children with all different kinds of epilepsy that have gotten better, from like 22 seizures. I remember one patient of mine, right, having 22 seizures every day. So he is down to 2 seizures now every day and still getting better. That's a big difference, so now he's starting to learn, because when you have so many seizures every day, you cannot learn. It becomes really difficult to acquire knowledge, to study, to gain any cognitive function. So we have to identify what is the problem. Is it inflammation? Is it infection? So for this particular child, his infection was more than the inflammation. So we found that he was responding better to infection treatment. So that's what we did. We gave him more treatment for infection, and everything else that we found in his labs was also addressed, of course. And after you get rid of the infection, then you have to repair the damage. Without repairing the damage, there is no basis for anybody getting better. Right? Or you don't stay better. The goal is, when you're doing herbal protocol, the goal is to get rid of the problem, meaning kill the infection, and then you repair the damage. And then after you repair the damage, you look at the progress. If the progress is good, keep going. If it is a little bit slow, then you go into phase 3, which is regeneration. So you can use herbal formulations to regenerate neurons and neuronal connections in the brain, in the gut. So that is how things get better and better, and then epilepsy slowly also gets better.
Okay, thank you very much.
For Nicoletta's son, most of the kids that are facing seizure before puberty or like later on in life, most of them have got febrile seizures, which obviously when there's febrile seizure, it's related to an infection somehow, because they are coming after a fever episode. So this should even more get you to think to an infection rather than a different sort of problem.
Exactly. No, that does make sense. And, it is important to consider is that if your child is getting a fever, that is a good thing. So this is a child that can get better. Instead of just giving medication to suppress the seizures, that's important, of course. If you're getting too many seizures, you need your seizure meds. But in addition to that, the cause has to be investigated. That's just common sense. Yes, exactly. Okay, now we have someone. Let's see. Who is next? I see that Ramona has just joined us. Hi, Ramona. I'm glad you could make it.
I'm not sure if she can talk. She's got a teenager, 16 years old, very difficult situation.
Oh, I'm sorry. Okay.
Aggressivity, a lot of hormone issues,
Acidity. Did you say acidity?
aggressivity. He is aggressive.
Oh, okay.
He's got infection with Toxocara. He's got Bartonella, is positive for them. And yeah, loads of behaviors are somehow unexplained. He's taking a lot of allopathic treatments. Some of them are for seizures as well, although he's not having seizure, but they are just to slow him down and keep control. And what Ramona was interested to find out is, would you recommend the CFS testing? What can show you the CFS, the cerebral fluid tab? What can it show us when we've got a case that is already confirmed somehow with infections and Lyme? What can it show us? Does it work to do the CFS test, or what's your insight?
Right. Where is Ramona from?
She's in Italy.
She's in Italy. Okay. Now, the cerebrospinal fluid testing is invasive. And there is absolutely no reason to do any invasive testing in this day and age, unless, obviously, if there is any kind of ascending or descending paralysis going on, if there is meningitis, if there is life-threatening, of course, you have to do what you have to do. But for Lyme disease, in this day and age, there is so much good testing available. There are so many practitioners who are trained. You don't really need to do any CSF testing. It is invasive, and if it was my child, I wouldn't even think about it. The reason if the reason for recommending CSF testing is that the child is not improving as expected, then it is the fault of the treatment, not of the child. So you should be investigating different kind of treatment instead of, invasive. One of the suggestions which was given for my son was to do a bone marrow. To do a bone marrow aspiration, bone marrow testing, because he was not able to walk, a lot of pain. His entire pelvic bone marrow on MRI was showing pus and infection and inflammation. So I'm like, well, you can already see on the MRI that there is some process going on in the full. Your pelvis is large. It includes both the hip bones as well. So why do you need to do a bone marrow biopsy? So it was explained, no, maybe we can send it to this specific laboratory that checks for infections inside. I'm like, well, we already have positive for Lyme and Bartonella and Rickettsia and Rocky Mountain spotted fever and blah, 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 and strep and staph and Marcons. Why are we doing anything invasive? And it was interesting, because after that, one of my really good friends is a cancer specialist. She's a pediatric oncologist. And she said to me that, there is absolutely no need for anything invasive. Just come in, bring his blood, I'll check and see if there is any bone marrow problem. And if there isn't, if the cells are normal, why go for it's a very painful procedure. So, you ladies who have had epidurals, that's what will be happening with your kid. If you go in for CSF testing, it's up to you, but it's not really required for confirming infection. What's required is proper treatment. And kids get better. There is no reason for Bartonella, Babesia, all of these co-infections to not get better.
Thank you.
One last thing I want to address this, I always talk about prioritization, right? So if you are treating infections, you can treat the infections till the cows come home. The person will not get better. All age groups, right? I get people who come to me that, we have Lyme and so many other infections, and we are doing first the pills, the capsules, the tablets, not working. Then they go on to intravenous, not working. Then they do all of these other unique treatments out there, right? Methylene blue, etc. Then they go for the invasive, where the blood is drawn, that blood is put through UV light and put it back in the body. It's like, okay, ozone injections, I don't know, all these different kinds of things, and they're still not getting better. Why? They have chronic fatigue. The reason for that is, in these people, the first priority most probably is inflammation. And the sources for inflammation have not been identified. And inflammation is there, it's growing. How will the infections die? They will not go anywhere. Inflammation is wonderful for the infections to grow and multiply. So that is why, individual labs, individual protocols, established priority, and accordingly you treat, and it is not possible that you don't get better. Everybody gets better.
Definitely. Exposure, I think, is the key.
Right. Yes, yeah. So that was for Ramona's family. Okay. Yes.
Basically, she's got loads of other problems with insulin resistance, and it's a huge picture that needs to be addressed. And basically, she's trying to find resources around her to treat things. Definitely, protocols are working, but she needs to find a more applied thing, like, I don't know, it's depending on testing, on so many other things.
Oh, yes. Yes, that is what it is. Identifying all the problems is the key. And once you identify, then you can treat. And of course, the person is going to get better. Without identifying all the problems, if the children are getting better, that's fantastic. I mean, they have good genes, and they are still getting better, even though there is exposure and many problems are not identified. So can you imagine the real potential of the child? Yeah.
Because you've mentioned earlier all those treatments that people are taking and are doing, and they're like getting invasive, more and more invasive. And
yes,
I would like to know personally, what is your view on stem cells for the autistic kids? But I don't want to hear about the good side, because everybody is talking about the good side, although you never really get to see it in the kids. You don't really get to see the results on the kids. You can see some mild things that sometimes at one point they start fading. But I would like to know, what can go wrong after a stem cell therapy?
What can go wrong? Okay, let's
question, Dr. Dashore.
right.
So
Yes.
what are the bad things that can happen after stem cell therapy? Because I think parents are just looking at the bright side of the story, like what can do good, but what would be the harm that can impact the kids after a stem cell therapy?
Right. I don't know anything good either. Right. Let me rephrase that. I don't know anything good that is permanent and lasting. In my experience, of course, I'm sure, people have different kinds of experiences. Now, I've had, families with major resources that have gone in for getting cell therapy 7 times, 10 times, without any underlying issues being addressed. And they haven't seen any benefit, or there is minimal benefit. Like, oh, he's giving better eye contact, so I'm going to celebrate that. But that doesn't last. And most places make you go back over and over again. You have to go back every 6 months, you have to. Now, let's just consider, this is how I can answer your question, right? What harm can be done? First of all, understand what is cells. Everyone's body, even yours and mine, in my old age, is capable of regeneration and producing stem cells. That is a natural thing that happens in everybody's body. You can take, antioxidant herbals or supplements. There are various ways to improve the stem cells production in your body, in your own stem cells, right? So that can happen. But if your body is loaded with a lot of biotoxins, biological toxins from the environment, from the furniture, from the car, from the cooking, from the food, from the the jibby jabs, right? So all of these will obviously impact every cell in the body, including your bone marrow, your spleen, where, and the places where stem cells are produced and generated. Because your body has a beautiful sensor system. The body senses that we need cells, and whatever cells are required, those are produced in the body, right? Now, if you have a child with PANS-PANDAS and you're going in for IVIG, for stem cell therapy, you have to understand, you have to be very, very precise, because the immune system is already boosted. It is not only boosted, it is dysfunctional. Okay, now if you're stimulating that child, you will see some minor improvements on the side, but overall, that is more harm, because you are consolidating PANS-PANDAS in that child, because, PANS-PANDAS is an overactive immune system. The autoimmunity, you're feeding into that autoimmune mechanism. Now, I'll give you one example that one of my patients, she bought photos and videos, and I'm not going to name the country and all that, but just, this was one stem cell center that was autologous. And that is, so they are not even giving you somebody else's, screened out, like, donor cells. So that, okay, well, I'm spending so much money, so somebody is giving me their wonderful, beautiful screened stem cells, right, as a donation. Nope, this is autologous. So they take your own stem cells and they put it in your child's body, and it is extremely expensive. So this was a place in a tropical climate. So there is a lot of rain. When you look at the building, you can see outside, the building is all moldy on the outside. There are air conditioners in every room. There is no information if those air conditioners are properly maintained for mold. We know that split air conditioners, window AC units, wall AC units, they are big culprits for mold in a humid, rainy, tropical environment. Okay, so you have this child, borrowing money from family members, etc., making the trip all the way, halfway across the world almost. Most parents have to drug the child to be able to manage on the airplane ride, right? So they go there. The food is obviously compromised. Then you have your child in this moldy room, right? And then the child gets chemicals. They get anesthesia. Even before that, they get steroids, they get antibiotics, just so that the procedure goes okay, right? So that the hospital is not held liable for all that. Before that, they make you sign everything. If something goes wrong, it's not our fault. And they do, yeah. So that's a given. That happens before any major surgery. So it's a major procedure. Then the child's bone marrow is stacked. That's a very painful procedure, right? That is why it's done under general anesthesia. That's why I had refused, and my oncologist, a friend here, had said no need for Brian. So they pull out your child's bone marrow, and then the child is given pain medication. So this is more medication. And then apparently the next day, same procedure is repeated with all of the same medications and through a spinal tap, which is similar to the epidural you get for C-sections, right? So through that, another painful procedure, your child's own cells, which have somehow been modified, multiplied, whatever, overnight they're multiplied, and they are claimed now they are in the millions. How is it done? Oh, it is a proprietary procedure. Are there any chemicals used? How is it done? Nobody knows. The claim is that whatever we are injecting into your child is millions and millions of your own child stem cells. They've been multiplied. How do human cells get multiplied so fast? How? I don't know why that is not being revealed. It's being hidden behind, oh, it's a proprietary procedure. Yes, but what is the basis? If you're multiplying cells in the laboratory, you know what? What is uncontrolled multiplication of cells called? In the body, that's cancer, isn't it? Uncontrolled multiplication of your own cells in the body is cancer. What is it called outside the body in a petri dish in the laboratory? No name to it. And those cells are being injected back into your child. And after that, this poor mother, and there has been many who've been to this, similar places, right? Then after that, they've been told that you have to give your child risperidone, and you have to go in for hyperbaric oxygen therapy, and you have to do intensive speech and OT and etc. And of course, is that included? No, that's an extra charge, right? So all of these, and then, apparently they took videos of this child. So this child is on Risdone, or whatever it's called in your country. It's an antipsychotic medication. So the child is a zombie. And, sitting there on the video, well-behaved, in this moldy room, in the moldy hospital, it's just unimaginable to me. Unimaginable that this information is not given to parents. Hyperbaric oxygen, what if this child has babesia? What if there are other aerobic infections? You're giving oxygen, why? So they grow? If cells are so great, why don't you see results right away? No, it's going to take 4 to 6 months. And before that happens, your child is going to be crazy hyper, will not be eating, will not be sleeping, will not stop moving, will be extremely hyperactive, and that's supposed to be okay. No, those are the prime symptoms of PANS. So your child, you've pretty much given your child a severe PANS flare. So I just do not understand why somebody would want to try. Then on the other hand, right, so that's okay. Then on the other hand, I've had adults who've gone, it was a big rock star, was, I guess, now retired, big rock star from Canada. who went to one Asian country for stem cells for Lyme disease. Because in the beginning, it was like this magic treatment for everything, right? It is a good treatment. People don't understand. There is not much of a difference between stem cell transplant and bone marrow transplant. Is it life-saving? Yes. For cancer patients, for complete paralysis, for spinal cord injuries, for Guillain-Barré syndrome, yes. IVIG stem cells, it is FDA approved for those major life-saving procedures, but is it for autism? Is it for Lyme disease? So this person, for 30 days, got a little bit of cells every single day. And I think it was extremely expensive, came back, once again, saw minimal treatment. He was advised to do hyperbaric therapy as well. So this rock star, he bought this hard chamber. He's in there 8 hours a day, sleeping in there. And then turns out that he started getting a lot of pain in his back. So he went to Stanford for spine surgery. The spinal surgeon opens, and what does he find in there? An aggressive tumor. So luckily he went right away because, unlimited resources, and was able to find that tumor. So I hear these stories over and over again. And it's just, it's an individual preference. Now, getting mesenchymal stem cells, exosomes, whatnot, there's a lot of different recipes that different centers have nowadays. Some of them say, oh, we'll also give you exosomes. Did you read about it? What is exosome? So what? Oh, no, exosomes speed up getting the cells inside. Inside where? They're already in your body. They're stem cells. They know where to go. You can't control them anyways, right? But okay. Now there are centers that give you, they actually give you a discount. It's just, I don't know, it's important to understand where you're going and what you're doing. These are, the donors are not screened because there isn't that technology available yet. It's not worldwide. Blood donations, blood plasma products like IVIG, they're not screened for Lyme disease. They're not yet screened for COVID. Because this is all new stuff, that new technology hasn't come on board. We got Brian one IVIG, right? With Dr. Kovacevic, God bless him, Miloslav Kovacevic in Chicago. He was the pioneer back in the day, 2009, I'm talking about. And you know what he said to me? He gave me complete transparency, right? He gave me the bottle of the IVIG from the donor, which was, FDA approved and all that. And it had the serial number, the barcode, everything, where it was manufactured. And he said, only one try for PANSPANDAS, because Brian was severe, as you know. So he said, no need to come back. You have to give it just the IVIG, right? And after that, now it's become every week people are getting IVIG, ridiculous. But in my experience, so he said, see if it works. Because the goal is that these donor antibodies are supposed to train our antibodies, our children's antibodies that are damaged because they are autoimmune, they are attacking the own body. So these donor antibodies that have that information, you know what? You're not supposed to attack your own body. So the goal is for the donor antibodies to train your antibodies. And then that's it. Once your antibodies are trained, why do you need to go back? Now, stem cells are 3 or 4 steps above just IVIG, correct? They're stem cells. So they are, in theory, supposed to train your own cells to behave themselves. Why do you need to keep going back? And it's just, I just don't understand the use of all of these chemicals mold exposure, you're doing an epidural into the spinal cord. What does that mean? Spinal cord is part of your brain. If it is in a environmentally compromised environment, in that operating room, what are you injecting into the brain? God forbid, mycotoxins. So it was, I mean, I've seen the photographs. I've looked up this place online. I've looked up a few other places online. It's just very scary to me.
Let's see if anybody else wants to, Elena or Nicoletta, someone else wants to ask any questions?
I forgot to mention one thing, sorry. So I met the owner of one of these places at a huge international autism conference that I was speaking at. And the owner, founder, medical director, everything, right? Surgeon, everything. Who does the procedure. And I said, I would like to bring my son. I mean, the presentation was done. I'm like, oh, okay, good. It's good. They're getting good results, so-called published papers and what have you, right? I'm sure they have published papers, individual case studies and whatnot. I'm like, okay, I would like to bring my son, can you give me some information? Here is the problems, and would you recommend? Will I see any benefit? I'll wait to hear back from you. I'm really excited after your presentation, that PowerPoint. So, I mean, the PowerPoint was like, stem cells transplant lecture. I think we were in Dallas. Yeah. The autism conference was either Dallas or Arizona. I'm not sure. I go to so many. So, stem cells PowerPoint presentation for Dallas, Texas, USA, etc. I was like, okay, good presentation. I am still waiting for that person to contact me. This is 8 years ago. Still waiting to hear back from the medical director that I spoke to on a one-on-one level, if it is safe for my son to go do it. Why would why? Because it's a practitioner. You're not willing to put your name on the line and say that, yes, it's going to help your son. Still waiting. Haven't heard back. And then yeah, what?
You spelled wrong your name, probably. That's why you didn't get an email.
Yes. And then I have heard from other parents, many parents from Africa, from Europe, from the US, who've been to this same place. And then I've heard that, apparently there are that same PowerPoint, exactly same PowerPoint is being used by other staff members of that facility in various parts of the world. And just that label is changed. Stem cells therapy presentation, instead of Dallas, Texas, it is London, UK, whatever, Toronto, Canada, Minnesota, USA. Exact same presentation. So that's what it is. Autism is big business.
Yeah.
Especially for desperate parents. It's big business. You have to be careful, and then you ask this, medical director, what do you understand about autism? And you get this, fully memorized textbook definition. It is a psychosomatic disorder, blah, 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 characterized by social. I'm like, really? Do you have any personal experience with autism? Any family member, any, whatever, like second cousin, twice removed? Nothing. No experience. No personal experience other than this big business idea, what to do. And I've noticed that in any field, if the practitioner has personal involvement, personal investment, then that makes a big difference. They understand where we are coming from as autism parents. as mold parents, as Lyme parents, what we have been through. Like Alexandra, with both her sons, she's been through a lot. Now, where did Alexandra go?
I'm here.
Oh, you're there. Okay, I thought we lost you. Yeah, so you've been through, with like paralysis, with facial deformity, with pandas. It's gut issues and IBS, and very similar to what I've been through with Brian. So we understand each other. That is a big, the same thing with this cancer specialist that I saw. She's been through it, with her leukemia with her daughter. So she knew what I was going through when I was losing my mind. And she had researched a lot, and she's the first one who told me to research pandas. It was called pandas back then. So it is a big difference, and obviously I'm not unique. There are many wonderful practitioners out there, who've been through this and who can relate to other families. But I think that is a big factor, is understand who your practitioner is and who you are going to. Especially nowadays, practitioners can treat virtually.
Definitely. I had a question from Ramona. She just texted me to ask, so her son, being a teenager with various hormonal problems and, as I said, severe aggressivity episodes, the only way she can settle him at the moment and is on the treatment of Risperdal. She wants to wean him off, but the problem is whenever she's trying, after a couple of days, she's already seeing him building up aggression.
Yes.
Is any step that she can take up till the moment that she would be able to see a practitioner and start like a proper protocol that she can take to remove him from Risperdal with something more natural, or anything that she can help him just to wean him off Risperdal?
Okay. Weaning off risperidone, you can try various natural products, but it will probably be difficult. Because with risperidone, it is pharmaceutical strength. You're forcing the brain to shut down, right? Now, herbals, you can try hemp oil, but probably will be temporary, because the underlying problem is not being taken care of, right? When she is seeing, Ramona, when you're seeing these spikes of aggression, and all living organisms have a reproductive cycle.
Yeah, that's
all infections, right? So every few weeks, if you're seeing crazy aggression, then that means that there's something happening.
Around full moon, they are building up. I
Okay.
know this for sure. So for sure.
Okay. So there is a lot of research, that long story short is that the little guys hide inside the big guys, like the spore form of Lyme disease, the other infections, they hide inside the big guys, which are the parasites.
Yeah,
right?
he's got
And
Toxocara. He's got high levels of Toxocara that
okay,
he needs to be
right.
addressed.
So when you're, many people, when you're doing parasite cleanses, right? Parasites can be amoebas and protozoas and tapeworms and all of those, right? So when you're doing parasite cleanses, understand that you're releasing whatever is inside the parasites. You're killing the parasites, but you're doing nothing about the Lyme disease that is released, any other co-infections that are released. Nothing is being done, and you're seeing these major spikes in PANS-PANDAS type behaviors because PANS-PANDAS triggers are released from those parasites. You cannot do that. What did I say? Prioritization is important. Is it good to kill the parasites? Of course, you will see some benefit, but you will not see anything lasting. I have had children actually also from Italy, Franco, 14-year-old His mom brought him to me. They came to the US to live with family in Brooklyn. And, you know, she used to come down to see me. Franco was on 4 psychiatric medicines, 4 of them. And he was, you know, because of that, his blood pressure was all over the place. So he had to take high BP medicines as well. And he was gaining weight because of the high BP medicines, like he was obese at the time. We weaned him off all 4. His mom has done a podcast with me long back. So we weaned him off all 4 medications. He is so many underlying problems, but Franco did so good that he got on his bicycle after 2 years of treatment, and he is going to school independently, studying, calmed down, lost a lot of weight. And, you know, as far as I know, I haven't heard from Cherie again, but that's because, you know, Franco's fine. He's been on a maintenance protocol for, this was 4 years ago. So I saw him for 2 years, and then he's been discharged for 2 years now on maintenance. You know, she orders her own supplements from the website. That's it. Not even a single consultation request. So, you know, she went back to Sicily and she's doing okay. He is doing okay. Franco is doing okay. All 4 medications have been withdrawn. He was 14 at the time.
I've got Elena's questions as well, if we still have time. She wanted to know if the Lyme disease can be passed congenitally, and if it's necessarily to come from the mother, or it can come from the father as well. And also, she was asking about varicella in pregnancy, if this could be like a cause for pans pandas in the child after pregnancy.
Okay. Varicella chickenpox is a virus. Viruses can be triggers, especially for pans pandas with epilepsy.
Okay.
It can have a viral trigger. Yes. Now, can Lyme disease be passed congenitally? Yes. Can dad give it to mom? Yes. So if dad has it and mom doesn't, during conception, it can be passed from one partner to another.
Okay. And it was another question in regards, I don't know, I don't seem to find it now. It was in regards to the plants high in estrogen, but my question is there hormonal activity, as in estrogen, happening to a years old? And what would be the approach in terms of plants that can be used? Because there are plants high in estrogens.
Right.
Yes. If the child has genetic problems with estrogens, yeah, can we still give them those plants, or they need to be substituted with something else that is lower in estrogen as well?
Either or
It
works.
makes sense.
Right. Either or works. For example, with Lyme disease, one of the products used is Japanese knotweed. And Japanese knotweed is high in estrogenic. First of all, plant estrogens. I mean, oh my God, you know, there are girls all over the world doing the birth control pill. Now, that is very strong lab-made estrogen. Okay, it is completely synthetic. And so many women around the world are on the birth control pill. And these women, you know, are worried about Japanese knotweed. I'm like, really? So no, plant estrogen is not as toxic as the estrogenic compounds that come from food, from water, from furniture, from PFAS, from outgassing, from cookware. Those compounds are really toxic, right? Because they are chemical, they are synthetic. Now, is there a need for herbs that are not estrogenic? or any kind of plant matter. There are lots of plants and herbs that can be estrogenic. You know, in the normal food we eat every day as well. I'm just not talking just about soy. Soy, everybody knows, right? It's a plant-based estrogen. You know, the numbers are not that high. And if you have a properly functioning liver, it handles anything excessive. It's, you know, just like if you are taking B complex, for example, right? B vitamins. And next day, when you pee, your urine smells like medicine. You know that your body has absorbed, hopefully absorbed, whatever B complex was required, and the rest has been eliminated from the body, correct? So the body can eliminate those if you have a functioning detoxification mechanism in your body. Estrogen is naturally elevated with mycotoxin and biotoxin exposure. Understand that biotoxin illness is not just mold. It has become famous because of mold, but mold is one of the biotoxins. There are many organisms that secrete biological endotoxins that are harmful to humans. That is why we run the labs to make sure that we are identifying everything that can cause that biotoxin illness. So I think that answers the question, right? So can it be handled? Yes.
I think it's the same misconception in regards to alcoholic tinctures and glycerin tinctures. You know, why would you give an alcoholic tincture to a child when you can give him glycerin? Well, it's not the same effect as.
It is not the same effectiveness. You know, most herbalists worth their salt. Most herbalists who know what they're doing, they can give tinctures to pregnant women, to babies, and you see babies getting amazingly better. I have one podcast which was done by one mom from California, baby Brixton, and she has shared photographs of Brixton, right? 5 months old when I got him. She already has 2 boys on the spectrum. Old 2 boys already, and this was, you know, extremely terrifying for her to think that, you know, this baby boy was headed in the same way. Yeah, and then now, if you see Brixton, I mean, he did full doses of herbals, of course, tinctures, full protocol, and in 7 months, it's a different baby. He's 14 months now, more than 7 months. He's 14 months now, and he is like, you know, oh my God, laughing, smiling, chatting, talking, playing pranks, being mischievous, you know, and she's so thrilled, like this is the first time I'm feeling like what being a mother really is.
Yes.
Having a child that is, you know, fully neurotypical. I have pregnant women that come to me for detoxification and rebalancing. The thing is, during pregnancy and during breastfeeding, we have to make custom formulation. Or if you're planning on getting pregnant, you know, and you want to clean out your body and rebalance yourself before, custom herbal formulation has to be made. I have one mom in Trinidad who went through the program. We had a fully herbal custom formulation, amazing pregnancy, no morning sickness, no tiredness, feeling really good. A baby was born in May, beautiful baby boy. I mean, did the herbals go to the baby? Of course, because mom probably gave Lyme disease and all the other infections to the baby as well, right? Because the first child is on the spectrum. And, you know, is mom going to continue during breastfeeding? Of course, because the baby is getting small amounts of those herbals in the breast milk. That's a great thing. And yes, they are tinctures.
There's one question from Nicoletta in the chat where she said, what test are you recommending for Lyme?
Okay. In Europe, Armin Labs is good. You have to do the TicPlex Plus, right? And then if you can afford the ELISpot as well for the same infections, at least for Lyme and co-infections, right? TickPlex Plus looks at many things. So that is recommended. The best recommendation I can give you is the one that I prescribe. If you're ordering Armin Labs, it's local. You can put down my name as your physician, no problem, because they will ask you who is prescribing. The best test here that gives best value for money is the tick-borne panel. So that a practitioner has to prescribe that. It is shipped from the US, but you get 22 pages of labs, and they are looking at many, many different species of Lyme, co-infections, as well as pandas triggers, viruses, bacteria, all of that. So that is the best test, the best value for money.
In addition to that, it doesn't matter what testing you do if you don't have a practitioner to help you up after the testing.
True. Yes.
What are you going to do with the testing?
Yes, I mean, self-treatment can be very problematic. You need to be careful with self-treatment.
Yeah, definitely.
It's so interesting, children are different. I've mentioned this earlier as well. I treat twins and triplets, right? They are so different with the infections, with, everyone's immune system is like your fingerprint. It's different. Everyone's immune system will respond differently to the same triggers in the same environment, in the same womb, same uterus, so twins have their own protocol, triplets have their own protocol, and you cannot go on support groups and forums and say, oh, this worked for your child, I'm going to use it in mine. You cannot do that. You just have to be really careful, especially in support groups where the admin or whoever runs the group is not willing to show their face. I've seen many support groups where they are using pseudonyms. They're not even using their own name, and they have this, all of these protocols. So you can use this. Why? Because my child had this problem, child had that. Like, why don't you show your face? Why don't you come on a video, do Facebook Live, no, nothing of that is happening. And then you have so many people just blindly following that. How do you know it's not causing harm? I don't know. If someone cannot reveal their real name, their real credentials, the face, why would you go for that? I don't understand. But there are, social media, you have to be careful. You have to be encouraged by people's success stories that, yes, autism, there is hope. I'm happy that so many families are sharing their stories, but that doesn't mean that you follow anybody blindly.
I'm going to throw in a season question now. Now it's seaside time. Everybody wants to go to the beach.
Yes.
Stuff. What are we doing with a child that goes to the sea, to the beach, and swallows water? Is there any protection that we can give them as a matter of, I don't know, something just to make their life easier after all that exposure? For the exposure.
Exposure to what?
Water, contaminated water, if I can say that, because you go and you take them to swim into the swimming pool, that's contaminated water.
Yes.
Contaminated water.
Yes.
What we use as a protection, or even for their skin, but especially for swallowing water.
Okay. It is important to take proper minerals and magnesium. Okay, they have to be bioavailable. And then even if you are doing activated charcoal, which is available anywhere in the world. So after you come back from exposure, just do minerals, magnesium, electrolytes, and charcoal. That itself will help the body. If there are any infections, those will have to be treated, but you have to identify the infections.
Profesoara mea. Nu?
Oh, this is Ramona. Okay, let me just mute for now. Now, one important thing, I forgot, Alexandra, is bug spray. Because when you're going, out and about in the summer, be sure that you have a good organic bug spray on the body. And if it's organic, you have to spray every 2 hours. And after they get wet, you have to reapply. It's a little bit of a problem, but we are talking major infections here. Come on, I mean, just reapplying the bug spray doesn't take that long. So remember to reapply, because there are sand fleas that can cause Bartonella and other co-infections. So it's best to take the precautions.
I will ask the question because lately I've got 3 weeks since I'm not feeling very well. I've been on and off the hospital almost every day.
Oh, I'm sorry. Oh, goodness.
It's not just me. There's something happening. I know at least 4 persons with exactly the same symptoms, which is heart palpitation or like pain in your heart, a blood pressure super low, iron super low,
Low.
pain in the bones, headaches, back pain. I don't know. It's like everything happening is a havoc of symptoms. All blood tests somehow normal is the feeling of kidney infection and DVT and all that. Everything is normal. On the side, I'm hearing loads of people around me saying that they've got COVID.
Yes.
I don't have symptoms for COVID. I've got completely different COVID, a lot more stronger. Could it be possible long COVID symptoms? As I said, it is not just me. It's like literally, I know 4 people around me, very close person that have got literally the same symptoms. Nothing seemed to worse. Antibiotics nothing is working. What would it be? What can it happen?
Okay.
It's my 10th time COVID, if it's COVID.
Right. I have seen time and again this so-called long COVID. I've had COVID 4 times. Especially the worst one was not in 2020. The worst one was this January, 2024. I got COVID. I told you. So it's a really bad strain this year. But anyways, I got over it. Now I have immunity, so I'm okay. But yes, so one thing that I've seen time and again is in people where they have other chronic conditions that have not been treated, and then you get a big, devastating infection like COVID, and it's a strong strain of COVID, that can bring to the surface your prior chronic underlying issues.
Okay.
So now it feels like that's it, I only have 2 days left.
Yeah, it definitely feels like this.
Right. And it is, it can feel pretty devastating, and it can look like a mystery illness, right? So, but what is mystery illness? Pretty much, you can call it long COVID, you can call it reactivation of old viruses, old bacteria that your immune system has been able to maintain because of the assault on the immune system that comes with COVID. So your immune system becomes compromised and isn't able to keep up with everything that it has to keep up with, because old infections are reactivated.
I was just literally thinking what these kids might be feeling if I can't.
Yes.
I can't move. So yes, Elena, have you got any other questions? Because I can see you now here. No? Okay.
I have another question.
Yes.
I want to ask something. We are in the process to take it off the medicine from the epilepsy from my son. We have 2 years without seizure, and now we have 1 week, and the all treatment is gone. Was to epilepsy because we try to uh, treat the epilepsy with herbal, but the seizure is repeating every 3 weeks, something like this, and that's why we try to treat the epilepsy with the medicine. And I want to ask now, it can happen again, the seizures after 2 years, and why we can do to be better, my son.
Okay. So if you tried herbal treatment and you saw that the seizure came back, right? So that is probably die-off. That is probably good news that you know that infection is causing the seizure. If you're killing the infection and you're getting more seizure, that's okay. That's only temporary. You have to go very slow. But what you're doing here is you are getting rid of the root cause. Okay, so now after you get rid of the root cause, the seizure will not come back. It may take some time to control the seizures, but once the infection is gone, once the inflammation is gone, remember what I said, there's one more step, you have to repair the damage. Okay, so what people who take seizure medications, what they do is you have forced the brain to calm down. The electrical activity, the misfiring in the brain is forced by using pharmaceutical medicines, right? So, okay, so if you take the medication long enough, the brain is just, okay, now brain is programmed, okay, this is no more seizures. Then what do you think is going to happen? The infections will continue to grow. And at some point, that dulling effect of the medication will go away, and then you will see seizures again. That is why it is important to always look at the root cause. Don't be afraid of die-off reactions.
Okay, thank you.
Hi.
Hi, Mariana.
If it's not too late, I have a question.
Yes, we have 5 more minutes and then I have to go. So go ahead, please.
I would like to know about Marcons. It's possible to that biofilm to be break down with just probiotics and herbal cocktail treating infection. Maybe in time the Marcons will be, the biofilm will be broken.
Okay. The Marcons and everything associated with Marcons has to be treated in the sinuses. You cannot take herbals by mouth and expect the biofilms in the sinus to go away. The biofilm blend that you take by mouth, that is for in the body, not in the sinuses. In the sinuses, there is the nasal spray treatment. The nasal spray, the nasal drops, it has to be a local treatment.
Thank you so much. Thank you.
Sure. Yes. All right. So we should come to an end for today. Alexandra, you want to wrap it up?
Yes, I'd like to thank everybody.
In your, in your native language, in English, however you wish to wrap it up.
Dacă mai are cineva vreo întrebare, să putem să închidem acum. Dacă nu, așteptăm să apară sau puteți să-mi scrieți să vă ajut să înțelegeți ce nu ați înțeles în timpul podcastului. Yeah, I have just translated to them and asked them if they didn't understand, just to write me down so I can translate them and explain to them what it's been discussed today and what we've answered to their questions.
Good, good. I'm glad. I hope you found it helpful. I get a little passionate about issues, But it's important. It's important to know, as mothers, it is very important to know what is the process going on in your child's body. Don't let any hospital, any doctor, anyone, not even me, don't let anyone tell you without you yourself researching what that is all about, and then ask good questions. Yes.
Definitely. Thank you very much, Dr. Dashore.
Bye
Thank
bye.
you.
Bye, Juliana. Bye, everyone. I'm glad you were all here to attend today.
We're
Bye.
gonna
Thank
see you very soon.
Thank you so much,
Thank
Alex.
you.
Anytime. My pleasure. My pleasure. Nice meeting everyone.
Bye.
All right. Okay, so that brings us to the end of today's Q&A session. I hope that was helpful to many listening and watching, especially those in the countries that speak the language. Okay, awesome. So I will see you guys next time. And thank you for tuning in. Be well, take good care of each other, and keep smiling, of course. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.